technology can affect liver surgery, and they're nothing to disclose. The specific ones we're going to look at is 3D printing, artificial intelligence, navigational surgery, and specifically HoloLens. 3D printing and liver surgery, this initial experience was from um, a collaborative effort between the University Department of Surgery, School of Engineering, and hospital, as well as private industry, with the goal being having the patient come with their CAT scan or MRI with a specific liver mass or masses to radiology, where through a portal there would be, and after a proper teleconference with the engineering department, this data would be sent over for digitization incorporation from a 2D to a 3D model, which would then be printed. Ultimately, the goal being to use that for education, for physicians, for the surgical team, for residents, for medical students, also to see if we could get improved patient family information and consent, and more importantly, for operative planning to see if we can achieve decreased complications, evaluation of effect in surgery. And the liver is not an easy organ to do that. It's actually one of the more difficult ones. The reason being that you have a combination of different tissues with the liver parenchyma, the vessels, biliary ducts, all the different tissues. So as you move through the process of digitization, modeling, and segmentation, initially you end up a result where you can see the different types of vessels, the portal branches, the hepatic veins, the hepatic artery branches, the mass, and the parenchyma. And when you move into printing, you also have to include a transparent way to show the parenchyma, so, and possibly one that you can cut through it. And this can be very helpful both in terms of the surgical resection or even liver transplantation, whether it's a living donor or not, because it gives the map, the geography, the lay of the land. And in a central hepatectomy with a difficultly placed tumor, it was possible to do that with significant help from the 3D model. And one of the latest goals has been to be able to project the 3D model either into the operating room or even better onto the actual liver itself using the cell phone, which cell phone screens you can see here, or glasses. Now there are significant challenges having to do either with the size differences have to be very exact, and that can be difficult in a 3D printed model. The cost, you can have printers which are worth a few hundred dollars to ones worth a few million. Depends on whether you use one color, more colors, what type of material you use for printing. So it's a combination of a lot of different things, and obviously the more expensive, the better the accuracy that one's going to have. And of course, everything is based on the quality of the original image, because that's the one that's going to dictate how exact the end model is going to be. The holy grail of transplant is bioprinting, with the idea being that you can 3D print a scaffold where you can use the bioink, quote unquote, which is actually stem cells, which in a proper environment can give you an artificial organ, as has been done in a small scale. And the reason is that once you move up more than a centimeter in terms of vascularizing the organ, that's very difficult. Also, when you have, when trying to print the whole liver, multiple cell layers, that can take several weeks. And also, you need the suitable cell types, not to mention the ethical questions that we can all imagine. Moving on to artificial intelligence. What is artificial intelligence? It's not something new. It's been there for several decades. And the idea is you have a device that mimics cognitive functions. And how does it do that? From taking over several data, and we're talking about millions of data, billions of data, the so-called quote unquote big data, which through the use of algorithms, you can improve machine learning. And as technology has improved and we've moved to the artificial neural networks, then you can actually go to deep learning. So the idea is through this big data, you can actually teach the machine how to come to certain conclusions. And we're reaching clinical stages in many cases, such as the one where AI systems have been compared to radiologists for good diagnosis in mammograms for breast cancer, robotic surgery. The cyberknife is another example. There have been cases of robotic surgery assistants, such as Penelope at Columbia University, 2005, and even ones being used for eye surgeries. Again, it's the idea of providing enough data to teach a robot or machine how to do certain things or to use the right algorithms. And this has also been used in the better flow of hospital and patient care. An example is the Judy Wright Capacity Command Center in Johns Hopkins, where you basically use artificial intelligence to track the occupancy of the different beds, different parts of the hospital, whether it's the operating room, the regular floors, ICU, and you can stay a step ahead of things. And this makes the flow and ultimately the patient care much better. However, there are significant challenges. First of all, we're talking about big data. It's very important how you're going to obtain them. We're not talking about data from one city or one place. We're talking from multiple centers, multiple places, even multiple countries. Now, the quality of the data just as important. The chef is only as good as their ingredients, and how are you going to safely obtain and secure this data is just as important. Using them can have certain obstacles. For example, the GDPR, which is part of the European Union legislation, and is very, very firm on the transfer of data, can be an issue. There are legal issues as well, not just in terms of obtaining the data, but let's say you've developed artificial intelligence, a machine that can be excellent at diagnosing cancers. If a physician has a differing opinion, well, who's going to decide which one, who is right? Now, whenever we're talking about technology, we have to keep in mind the economy. This is still a business. And then the final thing, which is really the key question in everybody's mind, is whether we're talking about assimilation or adaptation. And we have to clear the image of the movies where AI one day takes over the world. What we really need to focus on is learning about this technology, how it works, how it operates, what are the advantages and disadvantages, and be able to use it. The final part about navigating liver surgery, the whole idea is to be able to have a more focused resection, more targeted resection. And there are different ways to do that, whether it's a good old intraoperative ultrasound system such as MEVIS and Pathfinder, which give you the geography, the lay of the land, and more recently, the use of 3D imaging, which can be um, projected onto the actual organ, either through glasses or through computer, can give you can give you the geography and the map right there on the organ. HoloLens has been uh, Microsoft's take on augmented reality, where the use of multiple sensors and advanced optics are essentially melding the actual environment, the real environment, with the hologram and moving on to a simulated one. And the idea is that using a tablet or the movement of the hands, we can track and we can go over the steps of a procedure prior to the procedure. So, uh, being more targeted approach. Where does the future hold? Future is possibly a combination between the 3D imaging and printing and the use of artificial intelligence such as deep learning and quantum computing. The idea being that with artificial intelligence and the evolutionary algorithms, rapid prototyping techniques, you can actually obtain multitude of data to move towards the creation of an organoid, of an artificial organ. Now we're talking about extremely large amounts of data and also building more accurate models with cellular correlation, multiple parameters. In conclusion, it's very important to understand the significance of inter and cross-disciplinary collaboration. Engineers love to talk and work with us, and so do we, because we both have to learn a lot from each other. We also have to remember technology is not a substitute for proper technique. These are nice, fancy toys with great potential. However, we should not forget the basics. And finally, technology, we have to find a way how we're going to incorporate in global surgery, how people who are in most need uh, of these all different technological applications can use it, such as 3D printing and the rest. Thank you very much.